Hi, I'm Phil Bennett. I thought I'd tell you a little bit about myself and how I got to be the UK's only European expert in implantology. I qualified in 1978 in University College in London and pretty much worked in the NHS for 10 years being an ordinary dentist, Hertfordshire and other places. I then decided that maybe that wasn't what I want to do. I couldn't produce the sort of stuff that I really loved to produce, which was quality dentistry. So I moved into the private sector. I then realised that implants was an emerging field that could offer huge benefits to my patients excuse me, and to everyone else. So I then decided that I would try and train in implants. Unfortunately, there was no one in the UK who could train you in implants in those days, which was around about 1989. So I decided to take myself off around the world and try and learn implants wherever I could. And I went to the United States, to Germany, to Sweden, France, and just picked up little nuggets of information here and there, and gradually through experience managed to change the way that I work and learn how to do implants. In those days there was no formal training in the UK, so it was important that I managed to produce the results that I required just through experience. Over the years I've moved to become recognised by my peers, and I've become over the years the president of the Association for Dental Implantology and also its director of training and education, which obviously was a very important step for me. I've also originated quite a lot of original training programs for the ADI, and this has left me in a situation of having quite a lot of experience compared with most implantologists in this country. I was recently awarded the European Expert by the European Dental Association, and that was really the accolade that I needed. I really feel now that I have the experience and I have the ability to cope with virtually any implant case that presents, and more importantly I can even fix ones that go wrong. When I first started in 1989, if we had an implant that stayed in the bone after we'd placed it, we used to have a party because we were so excited that this technology would work. It seemed miraculous at the time. These days things have changed considerably, and now we find that implant dentistry is one of the most predictable treatments that you can possibly have, even more predictable than simple fillings and dentures sometimes, and obviously infinitely better. We've moved from a position where we used to wait for implants to heal for 6 to 8 or even a year before we actually could start work and load them and make new teeth on top of them, to a position now where we can even provide people with teeth in a day. They can come in the morning, have their teeth removed if they are obviously decayed or they have gum disease. They can have their implants placed, they can have the posts put into the implants, and they can have some teeth screwed into their jaws that they can walk away with and actually eat the same day. Now that is, I think, quite a miracle, but it's where implant dentistry is gradually going. It's becoming more predictable, more acceptable, more desirable. In fact, it's hard to find any negatives about implant dentistry.